Good afternoon, everybody, and a very warm welcome to Climate Action in Practice, a training on target setting and strategic advocacy in the healthcare sector. My name is Hope Robinson, and I'm the Climate Communications Officer at Healthcare Without Harm Europe. I'm joining you live from Brussels, and it is my privilege to welcome you today on behalf of Healthcare Without Harm Europe, and particularly the Climate Smart Healthcare Program team. I will have the pleasure of moderating today's session for you. So before we begin, just a few quick housekeeping notes for those of you not yet familiar with our platform, Hubelo. Welcome. The session is being recorded, and in the coming weeks, a link to the recording will be emailed to all participants and also posted directly on our website. Also, to quickly walk you through the features of the platform, on the right-hand side of your screen, you'll see the live chat tab. This is where you can submit any questions for your speakers throughout the session. Feel free to post them at any time. We will address as many as we can during the Q&A portion, which will be at the end of the session. It's also very helpful if you include who your question is directed to. So let's try out the chat. If you haven't already, please do go ahead and let us know where you're joining from. Just type your city or country into the chat box if you're comfortable. It's very exciting for us to see the wide range of places our participants are joining from Europe and beyond. So thank you very, very much for being here with us today. There's also a resources tab where you can find links to some of the guides and resources that we will be discussing today. So I encourage you to check that out as the presenters mention them and at the end of the session. Now, before we begin the training officially, I'd like to take a few minutes to set the stage by addressing three key questions. First of all, why set mitigation targets? Now, what's the role of strategic advocacy? And finally, why now? At the heart of today's session is the concept of mitigation targets, which are time-bound, measurable commitments to reduce greenhouse gas emissions based on a specific base year or emissions level. But why set them? Well, to keep global warming within the 1.5 degree threshold outlined in the Paris Agreement, we must reduce emissions dramatically and urgently. Setting mitigation targets is a cornerstone of that effort across all sectors, including healthcare. And targets provide a strategic framework. They clarify what needs to be done, by when, to what extent, and at what pace. Without clearly defined targets, action can become fragmented, delayed, or misdirected, a bit like trying to fight a fire without knowing where to aim the hose. That said, setting targets is very essential, but it is not simple. It's a technical process that demands robust data, sound methodology, and alignment with the latest climate science. Many healthcare organizations may lack the internal capacity or resources to take this on alone. That's where capacity building and practical guidance come in. And that's precisely why we developed this training at Healthcare Without Harm Europe. Our first speaker, Andreas Ekval, will lead us through the target setting component of the training. He will walk you through the key principles and practical steps involved in setting science-aligned mitigation targets. He will help demystify this process and equip you with the knowledge to begin translating emissions data into clear, actionable goals that your organization can work towards. However, setting targets is only a part of the equation. Targets on their own don't lead to change. They're one piece of a broader strategy. To drive progress, they need to be backed by strong leadership, clear accountability, and alignment with organizational priorities. And that is where the second pillar of today's presentation, strategic advocacy, comes in. One of the most common challenges we hear from the members of our networks is difficulty in securing leadership support or leadership buy-in for climate action. And as we all know, healthcare does not operate in a vacuum. Driving meaningful systemic change also means engaging with policymakers and broader stakeholders to create the conditions that enable action. Advocacy, therefore, is a very critical tool, not only for influencing internal decision makers, but also for building political momentum and contributing to wider societal transformation. To help us navigate this vital aspect of the work, our second speaker, Dr. Lujain Al-Qudmani, will explore how the power of healthcare professionals is strong to advocate for turning climate awareness and even formal commitments into sustained climate action. Dr. Al-Qudmani will share compelling stories of success from across healthcare and related sectors at the facility, national, and international levels. She'll also guide us through a practical, step-by-step approach to advocating for change with key decision makers. And that brings us to the final question, why now? As all of you here today likely already know and understand very well, climate change is already affecting our health and the health system itself. We already know the role of the health sector goes beyond just treating the symptoms or dealing with the fallout. We also have a responsibility and an opportunity to lead by example, by reducing its own climate impact and building up climate resilience. Policies are shifting, expectations are rising, and the evidence is clear. The cost of doing nothing is far greater than the cost of acting now. By being here today, you've already taken an important step. You're part of a growing movement within the sector that's ready to lead, adapt, and act. From improving operational efficiency to unlocking new funding opportunities and strengthening public trust in healthcare, the benefits of climate-smart healthcare are tangible and growing. Now is the time to build on that momentum by deepening your knowledge, sharing insights, and turning commitment into strategic action. Together, we can shape a more resilient, low-carbon future for health systems and the communities we serve. So thank you on our behalf for being a part of this movement. On that note, before we get into it, I would like to highlight a very valuable resource we released last year that remains, I think, highly relevant, especially for any clinicians here today or anyone not in a sustainability-focused role, but that's eager to start driving climate action. It's called the Pocket Guide for Healthcare Professionals: How to Kickstart Your Decarbonization Journey. It was developed based on a training we held last July and is a concise, user-friendly resource packed with practical strategies and insights for launching or strengthening your efforts to drive mitigation efforts in your organization or your facility. If you haven't explored it yet, we encourage you to do so, and also to share it with anyone new to climate action who isn't sure where to start. It covers 3 essential areas. First, the climate health connection, so understanding how climate change impacts health and why the sector must lead on climate action. Second, communicating to catalyze climate action, which shares key principles and techniques for communicating effectively to drive collective engagement both within and beyond your organization. And 3, understanding carbon footprints, simple steps to start measuring and reducing emissions in healthcare settings. You can access it directly by clicking the link on the screen now or by finding it in the Resources tab. So with that, let's get into the training. It's my pleasure to introduce our first speaker, Andreas Ekvall, Senior Climate Officer at Healthcare Without Harm Europe, where he supports climate mitigation projects across Europe and works closely with healthcare providers to advance decarbonization. With a background as an environmental management officer, he brings hands-on experience from both facility and system levels, as well as a strong understanding of the challenges that healthcare faces in reducing and measuring greenhouse gas emissions. His broader experience includes carbon management in both public and private sectors, covering climate accounting, life cycle assessment, and environmental management. He holds master's degrees in sustainable development, international humanitarian action, and environmental science. So welcome to the floor, Andreas. Hello,
Hi.
how are you doing, Andreas?
Hello. Thank you for that introduction. I'm doing really well, thank you. I'm really excited about this training.
Excellent. And can I ask where you're joining us from today?
I'm joining from Paris, France.
Lovely. Terrific. Okay, well, I'm happy to report that I can see you, hear you great, and see your slides. So the floor is yours.
Perfect. Thank you, Hope. So today I'm delighted to present one part of this training, which focuses on setting science-based mitigation targets in healthcare. This training will aim to provide you with a theoretical foundation to design targets informed by the science, enabling you to critically assess standards in the field. This objective will be achieved through the following learning objectives. First, we will cover the scientific and political basis for why mitigation targets are striving to keep global warming below 1.5 degrees. The second objective is to provide you with a background on how you can translate global and national commitments into tangible mitigation targets. Finally, I will cover 7 steps for developing mitigation targets informed by the science. One of the most important milestones in climate negotiations and for target setting is the Paris Agreement. It's a legally binding agreement ratified by 194 states to hold the increase in global average temperature well below 2 degrees and pursue efforts to limit temperature increase to 1.5 degrees. Also recognizing that this would imply significantly reduced risks and impacts of climate change. Since the adoption of the Paris Agreement, it has driven near universal climate action, sending signals to the world regarding the urgency of responding to the climate and health crisis. However, we are racing the clock, because to limit warming to 1.5 degrees, emissions needed to peak at 25 at the latest. However, global emissions have increased by more than 60% since 1990, and in 2023, greenhouse gas emissions set a new record. With each year of high emissions, the maximum amount of emissions or the carbon budget that we can emit while staying within the 1.5 temperature threshold decreases. And if we continue to emit at the same pace, this carbon budget will be transgressed within years. This would result in a warmer world. How much warmer depends on the actions that we take. Some scenarios estimate a world that will come between 1.9 to 3.1 degrees warmer. Consequently, climate action across the world needs to increase significantly. Otherwise, it will be impossible to achieve the goals of the Paris Agreement. Limiting warming to below 1.5 degrees would avert the worst damage and most catastrophic impact on ecosystems, where a temperature increase is an existential threat. For biodiversity, we're already seeing species loss and mass mortality. For human health, it's causing a range of issues, displacement and economic disruption. For the healthcare sector, it's causing infrastructure damage, disrupting supply chains, causing sudden influx of patients, health issues among staff, and it's threatening the shutdown of healthcare institutions. Climate change is already an issue, and with each tenth of a degree, especially beyond 1.5 degrees, the effects will worsen, causing stronger and more frequent extreme weather events. After reviewing reports, papers, and scenarios for this training, change is still possible, but the challenge to achieve a world within the 1.5 degree threshold is increasing. Healthcare's carbon footprint, coupled with its vulnerability to climate extremes, is a strong case for action. And now I'm going to cover 7 steps that the healthcare sector can use to develop mitigation targets informed by the science to contribute to a world within the 1.5 degree temperature threshold. Firstly, as covered by Hope, a mitigation target is a quantified commitment to achieve emission reductions, which is bound to a specific target year and set relative to a specific historical reference point. While a science-based target has a lot of similarities, the quantified and time-bound commitment is aligned with the Paris Agreement and of course informed by the latest science. The first step is to establish a greenhouse gas inventory or a carbon footprint. This is the bedrock upon which all meaningful climate action and target setting for a healthcare institution is built. To set mitigation targets, it's highly recommended to base them on a robust greenhouse gas inventory. This will enable the targets and actions to focus on categories with the greatest impact. It's further the reference point that enables the organization to track target progress. That is why it's important to have a solid inventory that is updated continuously, which further enables the assessment of targets' alignment with the latest science. To stabilize human-induced global warming at any level implies limiting emissions and the cumulative effects of greenhouse gases. This ceiling, or maximum amount that can be emitted, is what I earlier referred to as the carbon budget. Now, a few years into this decade, the carbon budget to remain within the 1.5 temperature threshold has decreased significantly. It's essential to be aware of this because each climate scenario is based on a carbon budget. This budget will differ. A limited budget in a climate scenario tends to indicate that the scenario is ambitious. To align mitigation targets with the latest science, we use climate scenarios, often referred to as mitigation scenarios. A climate scenario describes the future based on certain socioeconomic assumptions. This is modeled to illustrate how human activities will lead to different levels of emissions and global temperature increases or reductions. When setting targets, these scenarios describe both the pace and scale of emissions reductions needed to stay within a temperature threshold. In developing science-based targets, the focus is on climate scenarios that are aligned with the demands of the Paris Agreement. And I want to provide you with an example. C1 and C2 scenarios are a category of scenarios that I've derived from the 6th assessment report, which are aligned with the Paris Agreement. For ambitious healthcare institutions, C1 scenarios are preferred because they are more ambitious, as they result in no or a limited overshoot of the 1.5 temperature threshold. This means that between 2020 to the end of the century, the 1.5 temperature threshold will not be exceeded. Aligning emission reductions with the median C1 scenario would require reductions of 43% by 2030, 69% by 2040, and 84% by 2050. On a high level, when we want to create a mitigation target informed by the science and climate scenarios, we use the annual reduction rate and milestones, such as when emissions should achieve net zero, to develop targets. Fundamentally, we construct a mitigation pathway for our healthcare institution. This pathway describes our annual emission reductions in percent, which should be more ambitious or equal to the reduction rate of the climate scenario. This ensures that our annual reduction rate of emissions is aligned with the science. I want to emphasize that it's important to quantify allowable emissions in a scenario. That is, the total amount of emissions that can be emitted when following a climate scenario relative to its starting point. And this is a bit complicated, but you can read more about it in the resource that we will produce, but I want to exemplify it. So if you should choose a scenario that started in 2020, between 2020 and now, today, 2025, the scenario assumes that emission reductions were achieved. But if you did not reduce your emissions, the total or cumulative emissions will be higher than that of the carbon budget of the scenario, or what would be a fair contribution to the carbon budget of the scenario. Consequently, when you're designing a mitigation pathway, it needs to be scaled if your target starting point is later than that of the scenario. This also implies that if your emissions are higher than the scenario for a given year, then you need to modify your reduction rate to ensure that you're aligned with the scenario. Additionally, recent climate scenarios, such as the median seaway pathway shown in the figure, relies heavily on large-scale deployment of negative emission technologies or carbon dioxide removals. The development and scaling of these technologies have not progressed sufficiently. Consequently, achieving mitigation targets now demands a more steep pathway, which would rely on real-world emission reductions. When selecting a climate scenario, it's important to critically assess the scenario, and there is a range of criteria that can be considered to ensure its feasibility and alignment with the Paris Agreement. Firstly, each scenario should reach peak carbon emissions as soon as possible and have a reasonable carbon budget, favoring those with lower peaks and smaller budgets, reflecting higher mitigation ambition. Secondly, it should have no or limited temperature overshoot, as this minimizes long-term risks of temperature overshoots. Furthermore, scenarios should be realistic. To exemplify, with a high reliance on negative emission technologies, these scenarios can be excluded today due to their unproven scalability. This might change over time, and then we might have to choose another type of scenario. Scenarios should further be sourced from reliable sources. Please note that there are newer scenarios and more localized scenarios which are continuously emerging. Finally, scenarios can also be excluded based on their underlying socioeconomic assumptions. To provide you with an example, the scientific community developed 5 illustrative scenarios for the latest IPCC report called socioeconomic pathways. While some pathways are categorized as achieving the 1.5 goal, they sometimes do so with concerning consequences for climate adaptation and human development, including increased inequality and reduced equity. We often view mitigation as a sole object, but the long-term challenge is to contribute to a world that maintains the 1.5 goal while fostering healthy and prosperous life for all. This is directly connected to climate justice, which is an additional criteria because the remaining carbon budget can be distributed in different ways between different sectors. The Paris Agreement provides crucial insights for developing fair, equitable, and just climate action. The principle of common but differentiated responsibilities and capabilities is essential, acknowledging that nations have varying roles and capabilities in adapting to and reducing emissions, while underscoring the impact of climate change on vulnerable populations and the imperative to promote human rights. It further advocates for transparent and inclusive participation among parties and critically stresses the role of developed countries in providing resources to support climate action. These are not abstract principles. In the Global Roadmap for Healthcare Decarbonization, we created a scenario for the healthcare sector, which aligned it with the 1.5 temperature threshold. It highlighted that developed countries should reduce their emissions faster than developing countries based on their access to resources and technology. From a health equity perspective, certain health sectors and facilities may need to increase their emissions to meet the health needs of their populations, while others must go beyond climate scenarios in their emission reductions because they already have the technology, knowledge, and resources to reduce emissions. While there's a broad agreement that all actors should contribute to their fair share to global climate goals, the concept can be operationalized in various ways. For healthcare, health equity is essential, and there are several ways to contribute to this. Proactive adaptation and mitigation can help institutions remain functional during extreme weather events, while allowing others to increase emissions temporarily to meet essential health needs, supporting a fairer carbon budget distribution. This can be achieved by promoting cross-sectoral action to support healthcare and wider sectoral decarbonization, or through localized actions that reduce emissions and maintain essential health services during climate extremes, through inclusive community-centered strategies that empower populations to manage health impacts while lowering carbon footprints, by workforce-centered approaches that support staff well-being and improve health outcomes through mitigation. Fundamentally, achieving mitigation and adaptation requires sustainable financing, but it also requires access to knowledge, skills, and technology. Frontrunners can share solutions like low-carbon care models with their networks to advance collective learning and action. Here you need to consider how you can contribute to justice in designing your targets and climate action plans. When we look at different tools and resources for creating mitigation targets, we often encounter allocation approaches. These are essentially a set of rules for distributing climate budgets and aligning mitigation targets with various climate scenarios. While these tools are designed to be user-friendly, the underlying assumptions aren't always clear. Among the most prominent allocation approaches, two stand out: the convergence approach and the contraction approach. The convergence approach mandates that all organizations within a sector reduce their emissions to a specified emission intensity level for a given output. This level should be aligned with a broader sectoral climate scenario. In contrast, the contraction approach mandates that all organizations reduce their total emissions by a specific percentage measured between a defined reference point and a specified target year. As you directly notice, there are certain assumptions in these approaches, and it's up to you to determine whether you think these assumptions are fair. What matters is just not reaching net zero, but the path taken to get there, and importantly, the boundaries related to targets. To effectively track and compare mitigation targets, healthcare institutions must clearly define the boundary and scope of their mitigation targets. When setting targets, it's important to be transparent on what parts of an organization that are covered by a target. To set comprehensive targets, it's recommended that an institution use the same boundaries used for the greenhouse gas inventory. It's equally important to be transparent in the emissions covered by the target and be clear in any exclusions and limitations. For emission coverage, the recommendation on what scopes and percentage that should be covered depends on the standard used. The most relevant commitment for the healthcare sector, Race to Zero, recommends that at least 90% of emissions should be covered by the target. The time frame dictates when your target should be achieved, which influences the pace of emission reductions. Here we need to consider two important dates. The base year, your historical starting point for tracking your targets. The target year, the future date by which your target or targets should be achieved. Combining these defines your target time frame, and standards typically use short-term targets, providing immediate and actionable guidance to align efforts with climate scenarios in the next 5 to 10 years. Long-term targets. These outline the long-term vision for aligning emissions with the 1.5 temperature threshold. This is often referred to as a net zero target. I also want to recommend intermediate targets because they serve as a bridge between short and long-term targets. There are a lot of different types of targets. Today I will only cover 3 essential targets, and the most common target type is absolute targets, which are a commitment to reduce greenhouse gases by a specified target year and a quantified amount relative to a base year. Another common type of targets is intensity targets, which aim to reduce greenhouse gas emissions relative to a specific unit of service or activity, rather than focus on solely on absolute emission reductions. Then we have supply chain targets, extremely relevant for the healthcare sector, which are targets that are set to engage, calculate, and reduce the emissions of the supply chain. The final crucial step when you have developed your targets is to continuously monitor and evaluate your targets. In our healthcare decarbonization toolkit, setting a mitigation target is the 4th step in an 8-step carbon management process. The subsequent steps are designed to ensure that targets are backed by a well-informed carbon management plan. Moreover, given the long journey to 2050, we can already anticipate new scientific insights, new best practices, and updated climate scenarios. Such developments and changes to your greenhouse gas inventory will necessitate the recalculation of your targets. Our final resource will feature 2 case studies. One of them will highlight the insights from our Race to Zero hospital, the Moyer Healthcare Foundation or Health Foundation. FSM have a robust decarbonization roadmap extending to 2050. This roadmap includes multi-year absolute target with a defined base and target year. They have short-term targets covering scope 1 and 2, and FSM have already achieved a remarkable 91% reduction in these emissions and are offsetting the remaining 9%. They also have an intermediate target, which covers the entire supply chain. FSM has also taken diligent actions to reduce their scope 3 emissions. And they also have a long-term target, which encompasses both a beyond value chain target component and aligns with how we would define a net zero target or long-term target. For more details on FSM's pioneering actions and work, a link to their Net Zero Hospital will soon be available on our webpage on their Race to Zero. We have now covered the 7 steps to create mitigation targets that are informed by the science. We have discussed the importance of greenhouse gas inventories for target setting, how to operationalize and select scenarios, the importance of climate justice and health equity, how targets boundaries define the content of a mitigation target, different types of targets that can be used to operationalize mitigation commitments, and we have also discussed how to develop the time frame of targets and the importance of establishing a mitigation pathway aligned with climate scenarios. You are now well prepared to both tackle the creation of science-based targets and to use as well as to critically assess different standards. It's the first time that we focus on target setting, both as a training and as a resource. With that said, please reach out to me if you have any questions or suggestions. You can also ask in the Q&A. And let me know if you'd like us to have an additional training or even a workshop on the topic. Thank you for listening.
Thank you, Andreas. That was a terrific breakdown of target setting. Thank you so much. Now, as a reminder to our audience, please do post any questions you have in the live chat box, and we will address them in the final portion of today's training dedicated to a Q&A. Now, I'd like to introduce our next speaker briefly. That's Dr. Lujain Al-Qudmani. She is the Health Professionals Network's lead at Healthcare Without Harm, where she coordinates strategies and partnerships to mobilize health professionals in advocating for a just, equitable transition to clean, renewable energy. A global health and medical professional herself, she is the former president of the World Medical Association from 2023 until 2024 and has served as Chief Action Officer at EAT, a science-based platform for food system transformation. Her diverse experience spans clinical, organizational, and policy roles, including emergency medicine in Kuwait, co-chairing the World Medical Association Environment Caucus, and serving as International Relations Director at the Kuwait Medical Association. She holds a medical degree from Kuwait University and a master's in International Healthcare Management, Economics, and Policy from SDA Bocconi in Italy. I'd like to welcome her to the floor, Dr. Al-Qudmani. Hi.
Thanks, everyone. Hi.
Hello there. How are you doing today?
Good. How are you?
Excellent. Thank you. Thank you for being with us. And where are you joining us from today?
I'm joining you from Kuwait, actually, which is one of the countries that's expressing heat waves at the moment.
I can imagine. Well, excellent. I'm happy to say I can hear and see you perfectly, and also your slides on screen too. So the floor is yours. Thank you.
Great. Thanks a lot, Hope. It's a pleasure to be with you all today to speak briefly about strategic advocacy and the role of health professionals. But before talking about that, I found this very interesting survey that I thought should be quite relevant for the session and the presentation that was done by Ipsos. They do an annual survey about global trustworthiness. They do a public survey targeting adults under the age of 75 in multiple countries around the world, asking them, do you think each is trustworthy or untrustworthy in your country? And here is the ranking. As you can see, the first profession is doctors with a percentage of 58% and untrustworthy by 16%, followed by the scientists and the teachers. And despite the COVID-19 pandemic, the misinformation campaigns, the emergence of anti-vaxxers, doctors continue to be ranked number 1 in terms of trustworthy, which is the same result that they had in the previous surveys in previous years. But here I'm not talking only about doctors, but about all health professionals overall. As in Healthcare Without Harm, we truly believe that all health professionals have one of the most trusted voices not just in the global advocacy space, but also at national and local levels. Let me share some success stories about health professional advocacy that led to tangible results, collaboration, and impact. First, this is the one by Healthcare Without Harm, which is the Minamata Convention. Back in 1996, Healthcare Without Harm, which is back then was merely a coalition of health professionals, healthcare facilities, climate and health, environment, and health advocates. They really want to raise awareness and inflict change in relation to environment and health. And one of that is the impact of mercury and the presence of mercury in the environment on health, particularly the use of mercury in healthcare facilities. So they've organized Mercury Awareness Day and collaborated with one of the hospitals in Boston, an activity on thermometer swapping mercury thermometers with digital ones, and were able to convince every major US pharmacy chain to remove their mercury thermometers from their shelves. And their voice was so loud that other organizations, civil society organizations started to join in, including the WHO, that published an important document and a report about the impact of the presence of mercury environment on health. And our Southeast Asia chapter even organized a partnership and events together with UNEP. The Healthcare Without Harm main approach here was to use the best available peer-reviewed evidence to formulate its key messages, paying clear attention to clear goals and call to action in the conclusion and the recommendations in that evidence. And the main impact that we are very proud of is the International Convention on Mercury. We call it the Minamata Convention, named after the city in southern Japan, where it was signed back in 2013. And it really represents the global consensus and recognition that the release of mercury into the environment presents a worldwide threat to human health and natural ecosystems. Until this date, there are 152 countries who ratified that convention with very clear accountability measures with a reporting rate of 86%. Another global example, which is more recent one, is the COP28 Health Open Letter. The UN Framework for Climate Change Convention organized their 28th conference in UAE. So UAE was holding the COP28 presidency, and here the health professionals came together and co-signed an open letter directed towards the COP28 president, as well as leading negotiators, calling for an urgent action for just transition and fossil fuel phase-out, given the impact of fossil fuel on health. And as suspected, we didn't reach our impact, which is the recognition of the importance of fossil fuel phase-out and the mention of fossil fuels out in the conference outcomes. But we've witnessed a massive joint action by many organizations representing more than 46 million health professionals, and it got wide recognition, attention, increasing public awareness, including more than 100 media hits, over 4 million downloads on our website, and even motivated other sectors other than health to join our call, including 100 cities, more than 200 businesses, and over 600 scientists. One of the big achievements that we saw, that is the first time ever that the World Health Organization, which is a UN entity, finally called out for fossil fuel phase-out at the COP itself, which is a topic that they usually shy away from. If we go to the regional examples, we have the medical education reform, where there is a group called the European Network on Climate and Health Education, recognizing the importance of capacity building and early education of climate and health, and seeing the huge gap of what we are taught in medical school versus what we see in hospitals and healthcare sectors compared about the health climate impacts. They advocated for incorporating climate-linked diseases into medical curricula. And they succeeded in doing that across 25 institutions, particularly UK, Belgium, and France, to ensure that the future doctors are equipped and have the right knowledge about the climate-sensitive health conditions. And here is on the right side a snapshot from the Guardian article that showed that a success story by advocacy, by health professionals to change the and inflict change at the medical school level. If we talk about national level, I would like just to mention an interesting one, which is in Spain. So Madrid launched in 2018 low emission zones, restricting non-resident, high-polluting vehicles on entering the city center. And it has been the most effective zones in the EU. They were able to reduce their emissions by 32% compared to 2018 levels, and even reduce and prevent more than 500 premature deaths annually from the long-term NO2 exposure, and another 88 deaths from PM 2.5 reductions. Now, what is the role of health professionals in that? When Madrid first started to implement those zones, they faced a lot of political rollbacks, backlashes. So the public health advocates, including the clinicians and patient group, they've been defending those zones, joining city-level consultations, and even aligning their efforts with the EU legal frameworks. So supporting the city-level work that succeeded to even amplify it into Madrid 360 to encompass the entire city by early 2025. So the city had reported its lowest pollution levels in over a decade just last year. Now, jumping into advocacy and strategic advocacy, step-by-step guide. Hope at the beginning of the webinar mentioned that we have published a guide about advocacy and campaigning, and here I'm presenting a summary and a gist of it, just to help you understand that it's something feasible, applicable at healthcare facility level in terms of inflicting change at the level of the leadership of the healthcare facility, or even department level, at a city level, country level, or globally. First, it's important to identify the issue, a specific issue with a clear outcome, to make your path towards that advocacy campaign clear with less ambiguous steps. It's important to research your subject, to arm your argument with the best available evidence, research. What are the related factors to your issues? And to do that, an example is to conduct a situational analysis using PASTEL. P stands for political, economic, social, technological, environmental, and legal. So to understand the multifactorial causes of the challenge that you're trying to address. Third, to know your supporters versus potential enemies. So are you the first one who's trying to address that issue? Has it been addressed before? What were the outcomes of past advocacy efforts? Are there other stakeholders who are trying to inflict in the same change? Could they be potentially your supporters? And then fourth, to set clear goals that is well-defined and achievable. And that an example could be by 2030, my healthcare facility would have reduced their greenhouse gas emissions by X percentage. That, for example, is a clear target. Or your target could be as a city level in relation to the air pollution levels, or at the country level, or even a global one, including the integration of health in your country's climate adaptation plans, for example. The second question that you need to ask yourself is, who do you need to influence? Who are the main decision makers that are responsible for this change? Where do they live? What policies have they supported or opposed? Just understand a bit their political direction and how they think. What is their main motivation? What motivates them? What do they believe in? What is their worldview or general philosophy? Have they supported a previous cause before, or a charity before? Or is there a certain campaigns that they have been associated with? Third is to see, how can I exactly influence those decision makers? First, to create a well-defined message directed to those decision makers. And that message should not only focus on scientific facts or an outcome of a research, but try to use a storytelling approach. Combine it by a story that you personally experienced with your patients or with your work at the healthcare facility. Try to mix it up with reason and emotions as well to make it a bit personal. And don't only present the problem, but also propose solutions that you would see for that problem and suggested actions to implement that solution. Second, you cannot work in isolation. You need your group of supporters and influencers that will support your cause, have the same motivation, and even help you and participate in the planning process for your advocacy. And try to your best to include the ones, particularly the ones who has influence on your targeted group and can influence those decision makers. Then you need to choose your campaign tactic. The campaign tactic needs to be able to apply pressure on the decision makers or the leaders to inflict change, to be able to build power in your group of your supporters and the campaign participants, and also to build them as leaders for change. It's not enough to select only one tactic, but you need to be able to be flexible enough to change that tactic and create new ways to continue presenting the issue itself, whether to change from one tactic to another. And that's what's called sequencing, as well as escalation of the tactic, depending on the kind of attention that you've got as you move on with your campaign. And mainly we divide tactics into two groups, insider and outsider. Insider, that an example of insider tactics are consultations or dialogues with the leadership or the main stakeholders who work in the same departments that you are targeting. Or outsider tactic, it means that here you are engaging the wider public. That includes awareness campaigns, media attention, open letters with public signatories. And then for those messages and for those tactics, it's important to establish a clear timeline of implementations. When exactly am I launching that tactic? And when am I exactly launching those messages? Bearing in mind the time it will take to develop them, revise them, and having the buy-in from your supporters. And as any campaign, it's important to manage risks and monitor success. Manage risks, that is, be able to identify possible risks in advance. Possible risks include, for example, lack of fundings or political barriers that you're unable to get the attention of the decision makers, or low buy-in from the general public. They're not very paying attention to that issue. Or it could have consequences on you personally, losing your job and to be able to be demoted to other position. So try to list all these possible risks and see how to avoid them if you can. And then as you go on with your campaign, it's important to monitor success. Regularly monitor any changes in the position of the decision makers, the attention that you get from the public, any changes in the practice itself, and try to gather that evidence and accordingly adjust and improve your strategy. This is just like a step-by-step guide toward advocacy and campaigning. So if you find this very interesting and you would like to study more about it, we've just launched today, together with our partners. One of them is the FXP Center for Health and Human Rights at Harvard University, a global coach fellowship, a fellowship that focuses on advocacy and community building, to equip health professionals with the skills that they need in community organizing, in strategic storytelling, and health equity leadership that starts next year in March. And if you're interested to apply and know more about it, you can see more in the link that was provided to you. And I would like to conclude by an upcoming global climate milestone, which is COP30, the UN Climate Change Conference that is going to be held in Belém, Brazil in November this year. And under the Brazilian presidency, they have identified health as one of their strategic priorities in their action agenda. And they are currently carefully drafting what they call the Belém Health Action Plan that is focusing on adaptation of healthcare sector to climate change. And they identified two important pillars. One of them is health equity and climate justice, and the other is leadership and governance on climate change and health with social participation. This health action plan will be further studied and modified next week, actually, where there will be the Global Climate and Health Conference in Brasilia, followed by member states consultation to have it officially presented in November. At the end of August, our colleagues in Latin America, they're organizing an online forum inviting all health professionals around the world to join to hear more about what's going to happen at COP30 and the experience of health professionals in that region, focusing on resilient healthcare system. It's free and open for registration, and we'll be able to share with you the link if you are interested to join. And then the second, recognizing the importance of the role and the voice of health professionals, we're launching a campaign called Health Professionals to Leaders Act Now, where we want your voice to demand to action through a small video clips that we can put together and disseminate right before COP30. I'll stop there and happy to answer any follow-up questions.
Thank you so much, Sujane. Dr. Al-Qudmani, I really appreciated that. I'm sure our audience did as well. Advocacy can often be underestimated, in my view, or sort of qualified as something that you're either good at or you're not. So I really appreciate, obviously as a comms professional as well, I'm biased, but it's great to be reminded of how it can be learned and what impact it can have. So thank you. Now to begin our Q&A component and answer some questions, I would like to welcome Andreas back to the floor to join us. And also remind our audience that if you do have any questions at all, feel free to share them in the chat. We have some from other sources as well that we will answer in the meantime. And perhaps let's start with one for Andreas that I saw in the chat from Nada earlier. which was when a health facility setup is growing operationally, for example, how effective is using the baseline in terms of comparing past and future emissions? How do you compare the growth?
This is a really complicated question, an excellent question as well, I have to say. There are several ways of approaching this, and one of them, I did not discuss this today, but there are different ways of thinking about base years. And we don't have to use a fixed base year. An alternative is to use a rolling base year. And this is when you systematically move your base year forward. Why this is helpful is because then your new baseline will be more relevant and reflect the growth of your institution. The issue here is, of course, that this is not always recommended by standards because your emission trajectory is not, and the cumulative emissions are not necessarily accounted in your mitigation pathway. So that is one of the challenges with this approach. I recommend this. This is covered by some of the biggest science standards out there. I think it's covered in the corporate standard developed by the Greenhouse Gas Protocol. I'm going to cover this as short as can. Another approach is to use significance thresholds. I didn't cover this today. And these are recommended to have both for targets and greenhouse gas inventories. That is, when your greenhouse gas inventory passes it can be a quantitative or qualitative threshold, you always need to recalculate your inventory and your target, especially if you have a science-based target, because what is interesting here is not only your emission reductions this year, it's the cumulative effect of your emissions. And here again, there's a lot of guidance on this. I recommend checking out the Greenhouse Gas Protocol. They define the threshold. I think it's normally around 5%. I think this also feeds into an even more complicated question. That is that there are currently a lot of challenges in assessing the scope 3, and we tend to lean on proxies here. And this results in uncertainties in our greenhouse gas inventories. So even if your emission baseline or your institution is growing, there are, as of right now, normally large uncertainties in baselines. But we still recommend that you calculate them and use proxy data. And they do still pinpoint some actions that you can take. And as long as you're transparent in how you use your baseline, that is the most important part. And yeah, I think that's the most essential part, actually. Be very transparent in how you use it. But to summarize it, it is a challenge, and this is experienced by a lot of institutions that are growing.
Makes sense. Thank you, Andreas, for that. And I wanted to take a sec before moving to a question for you, Dr. Al-Qudmani. Tiana, you earlier asked a question. Could you please provide some entry points in the procurement process associated with decarbonizing healthcare facilities? Now, although we didn't speak specifically about procurement today, I wanted to share with you, Tiana, that we do have a previous guide, the quick guide to climate smart procurement. So I'm going to share the link with you in the chat here now, and I would welcome you to check that out as a better answer to your question, since we didn't speak about procurement specifically today. So please do find that there. Now for you, Dr. Al-Qudmani, a question that we received was, is there some common mistakes or pitfalls that people tend to make, and by people they mean healthcare professionals, when they're trying to advocate for climate action internally, and how could they maybe avoid them?
Yes, of course. One of the important pitfalls is the fail to recognize that there is one size that fits all. Sometimes using very global resources, messages that has a global audience and try to apply it locally or nationally without tailoring it to context specific or related to the national circumstances or to the national challenges. The second one is to try to push hard for climate and health action without fully recognizing and understanding the political context. Unfortunately, the lack of climate action or lack of ambitious climate action is merely a political one, where there's a vested interest, conflict of interest, and in some regions, even lack of resources and finances. Without understanding that context, it sometimes leads to confusion and lack of trust to those climate and health voices because they're coming from the outside without understanding the context itself. And that's why I've added in number 2, after identifying their cause, is try to carefully study all the factors surrounding that cause to really arm your messages and arm your campaign.
Perfect. Agreed. It's almost like you need to anticipate in advance what things are going to come up against so you have a full strategy, I suppose. Okay, thank you. Then another question for you, Andreas, which is, how would you recommend healthcare staff without a data background approach setting meaningful and achievable targets? For one of us like me, I'm not a data person, so something like that, perhaps.
Yeah, I think it's a great question, and I think there's a lot of different ways to approach how we work with climate action. We often say what gets measured gets managed, but that can be true, but you do not necessarily have to follow that kind of reasoning. There are other ways to take action, and let's say that you are in a department, then your focus might not be in measuring the emissions. Instead, what can be more important is to take tangible actions that will contribute to the reduction of your facility's carbon footprint. But if you want to calculate your carbon footprint and develop a carbon management plan, we are currently developing a standardized decarbonization journey for those who are new to carbon management. And if you're just starting out, I would highly recommend the Climate Impact Checkup online course. Here we cover both the relationship between health and climate change. We cover what a carbon footprint is, and we cover how to systematically develop climate action plans, or what we call carbon management plans, to reduce your emissions. But if you are further in the process and you're interested specifically in data collection, we do have methodological guidance for using our Climate Impact Checkup, which is our carbon footprinting tool, which is used by I think we have over 1,000 carbon footprints, even more so actually, in our system. I highly recommend that. But if you're past that phase and you're looking for action specifically, we have developed over 350 case studies on different actions that will reduce the environmental footprint of the healthcare sector.
Thank you. Now, Dr. Al-Qudmani, we have a question from Nada for you. Would you have happened to have conducted a scenario planning for the UAE/GCC healthcare climate advocacy?
We're not very active in the UAE, but I must admit during the COP28, the COP28 presidency, they made a huge leadership effort in establishing the COP28 Climate and Health Declaration that was signed by, I think, over 116 countries now, and translated that effort at a national level in the leadership of UAE government. As well as UAE is a member of ATACH, which is an alliance that is focusing on resilience healthcare system with a strong leadership from the UAE government. In the Healthcare Without Harm, we have conducted several trainings on the healthcare sector adaptations to those ATACH members, but we haven't been engaged to the advocacy with the civil society per se.
Thank you. Now, an additional question for you is from Jessica. How can individuals without institutional backing go about advocating for climate action in the healthcare sector?
Oh, they definitely can, because being as a health professionals, you still have this public trust and the moral authority, even without institutional backing and affiliation. We have many examples where those individuals usually are active at comms and media, writing op-eds, blogs to try to have an influence on the general public, not just the local publications, but even professional ones, and joining existing networks where there are global ones, regional and national, joining existing campaigns per se, rather than just focusing on stall efforts. And if there's a certain cause that interests you and you are quite passionate about, you can even start your own local chapter or peer group, where you can slowly try to establish that network of like-minded individuals or professionals to focus on the specific issue in terms of advocacy and campaigning.
Excellent. Agreed. Thank you. I would like to now move to a question actually from Shathab that I think perhaps could be relatable for both of you, but particularly for you, Dr. Al-Kadmani. Shatha wants to know, do you think studies on health workers' awareness of their role in climate action are sufficient? So I'm not sure if Shatha means, do you think the studies are seen enough, or if we think healthcare professionals aren't aware enough of their role in climate action? But I think perhaps the latter.
Yeah, this is something I also personally faced while working in the healthcare settings. Back in the early days, I had my colleagues who were working in the same hospital. Why are you focusing on climate and health? There's nothing that healthcare professionals can do about it, and this is the job of the policymakers. Until this day, even though there's a great awareness about climate change, its health impacts, we're seeing it firsthand in the hospitals and healthcare settings, there's still lack of awareness of the important role that they can play in advocacy and affecting change. So this is an important role for us to do here in this webinar and beyond, to try to continue to put that awareness as well as the capacity building. And we're trying to do a lot of that here at Healthcare Without Harm in many initiatives, including the coach that I just presented.
Indeed. Thank you. Now, I'm going to come back to a question from Alice, but first, Pamela, I saw you comment that the climate impact checkup, doesn't cover how organization can act on health promotion and mitigating the progression of disease, which we know has the biggest impact on climate footprint. And I think, Andreas, it's more of a comment, but I'll address it to you because I think you could probably speak on why the impact checkup doesn't cover that, right?
Yeah, I can, but it's a great question. And actually, a part of developing today's training, I was looking into different types of targets. They are often called beyond value chain targets, which is where I would see it. It happens outside the institution's boundaries. And it's more than true what Pamela is saying, that potentially the largest impact would come from preventive action that reduces the need for healthcare, effectively reducing the amount of patients that need to come to healthcare institutions. And I think as a clinician, there's a lot of different ways you can contribute to this. And we were talking about Attach earlier, so I'm going to jump on that and connect to what Liane said earlier. They have a fantastic bibliography that covers a lot of different resources, and they recently published a resource on primary care and the role of primary care, which outlines tangible actions that you can take. So I highly recommend looking into that resource. And our final resource for this training, I will also include a description of these kind of targets and also try to include some suggestions on specific.
Yeah, thank you. Thank you. Indeed. I hope, Pamela, that was sufficient for you. And you hit the nail on the head that that's a hugely important part of the work. And that not every tool we develop can cover it all, but it's certainly essential. And we look forward to doing more work on that in the future. Now, I'd like to go back to a question from Alice Wu, which I think actually is maybe more directed to you, Andreas, but also Dr. Al-Kadmani, if you'd like to offer comment. Alice asked, how can we strike a balance between spending a lot of time and resources setting climate goals versus concrete action that has more direct results? So maybe you can speak a bit to the relationship between the planning stage and the action stage.
It's a great question. It's a complicated one as well. Again, of course, great questions from the audience today, really. I don't think there's necessarily a conflict here. So we are seeing that some of the front runners in the field, what they're doing, especially for Scope 3, which is the elephant in the room, maybe the largest challenge at the moment when we talk about reducing emissions. And what they're doing, reflecting on what I discussed earlier, they're creating engagement targets. So what they're doing is that they're both getting the data from the suppliers to create carbon footprints, while simultaneously asking the providers to create carbon management plans. So I don't think there's necessarily a conflict here, but I think isn't initially the importance of a carbon footprint really lies in pinpointing where you can take actions to ensure that the actions that you take have a great or a meaningful impact on your institution's carbon footprint. And considering the timeline in front of us, there is a great urgency here. And that's also why I think it's very important to have that baseline to understand where you can make the most meaningful impact.
Well said. Did you have anything to add, Dr. Al-Qudmani?
No, I think Andrea's covered it well.
Agreed. And Pamela, I saw that you pointed out that climate action is not in the higher education curriculum for health professionals in the UK, and that the health promotion agenda doesn't map to climate change. And although I'm not the expert that these two are, I can say I'm certainly aware of that. I think we all are, that there's still a disconnect out there. And I want to encourage you, Pamela, to check out the work of the Groenzorg Alliance, or the Green Health Alliance in the Netherlands. They did some terrific advocacy to have climate action put on the curriculum in the Netherlands for all the participating medical schools. And that was a fabulous step that they achieved. The leader of their network recently won a prize through our European Sustainable Healthcare Awards. So we're going to soon be releasing an article on her work. And that is something where I think health professional advocacy can play a extremely crucial role to get that on the curriculum. So very, very good comment. Thank you. Now we're coming sort of to the end, so I want to maybe ask you both if you had one core message you wanted people to take away with them today, if you could share it with me now. Maybe you first, Andreas?
Sure.
Sorry, I'll give you.
Well, I think a cool message from my point of view is that if you're new and you're setting mitigation targets, and I did not mention this, but then you do not have to go full out and create a science-based target. But in the long run, especially when you have what I'd say a more mature inventory, the goal should be to develop a science-based target, mainly because then you're assured that you're contributing with a fair contribution, or your fair share, to stay within the 1.5 degree temperature threshold.
Great, thank you. And you, Dr. Al-Qudmani?
If you're interested in climate change and health, and you would like to inflict change and join existing or start new advocacy efforts, my advice is just don't give up. You might feel like it's a complex political playfield and sometimes resource competitive, but start to have a clear vision, targets, and a group of supporters. It's kind of work they cannot do in isolation or silos, but try to link with similar-minded professionals that join your mission.
Indeed. Well said to both of you. Thank you so much. Now that brings us to the end of the Q&A. So thank you both for your presentations today and for your responses to the many questions that we had. Thank you. And it also brings us to the end of today's training, Climate Action in Practice. So I would like to thank our audience, you all, for being here today, for engaging with us in the chat, for your questions, your comments, for challenging us. We really appreciate it. And your dedication to putting climate action into practice is what drives real change across healthcare in Europe and far beyond. So please, I would like to ask you to take a moment to complete the questionnaire that will pop up on screen when the training ends, as your feedback is incredibly valuable to us, especially because we are developing a resource based on the content of this training, which will be released as a guide online by the end of the year. Your questions and your feedback will inform its creation. So do stay tuned for its release by following our social media, subscribing to our newsletter, or joining our networks, and we will announce it as soon as we can. The recording of the event will also be made available on Hubelo, this platform, once it's complete, and will also be uploaded to our website in the coming weeks. The resources under the Resources tab, including the link to the Coach Fellowship that Dr. Al-Qudmani shared, will be shared with you in the follow-up email that you will receive tomorrow. We look forward to your feedback on today's training and to continuing this work together. So thank you very, very much, and take care. Goodbye.